Welcome back to the Modus Movement podcast. Before we dive in today, Dr. Pastore and I just want to take a moment to thank everyone that has sent us emails either about the podcast or to ask Dr. Pastore questions. We've had people reach out from around the world, and for us to know that our reach is that large and that you're learning and you're enjoying the content, it really does mean so much to us. So thank you for that.
Yes, thank you. It really is just great to hear that how well this show is being received.
So 2 episodes ago, which was episode 11, Dr. Pastore covered food intolerances for an NHL strength and conditioning coach's audience. Now, I'm going to be completely honest and say that half of that information went whoosh right over my head. So when I had finished editing the audio, I asked Dr. Pastore if we could do food intolerances part 2, so that no matter what your background or level of education is, you can still have a good understanding around this topic. So Dr. Pastore, if you can start with, what is a food intolerance?
Absolutely. And thank you, Lexi, I love how you brought this to my attention, that we need to make this an extremely understandable topic. So let's do our best today to do so. And I'm begging you to help me with that so we can convert some of my language into more understandable terms. So let's talk about the clear definitions of this topic, food intolerance, by 2 very well-respected organizations. So on one side, we have the American Academy of Allergy, Asthma, and Immunology. And on the other side, we have the Australasian Society of Clinical Immunology. So they kind of are similar in their definition, but there's a little change. And I'd also like to add in that I slightly disagree with both of them with the utmost respect. So the clear definitions by these groups are: a food intolerance is a reaction to a food or food group that basically only impacts the gastrointestinal tract in a negative way. And the only difference between those 2 groups is that the Australasian Society says, well, it could also give headaches or maybe some mouth sores, which I believe the listening audience knows as canker sores. We know what those are, those really irritating things. And then you drink orange juice or eat a banana and you're like, yikes, that's uncomfortable. So that group feels that that's also in the group of a food intolerance. Here's my issue. That's not what I've seen in clinical practice. Sometimes I scratch my head and I say, I wonder who's practicing in these organizations that comes up with these definitions. I've definitely seen food intolerances that are actually not true food allergies transpire with symptoms outside of the gastrointestinal tract. So I'm asking our listeners to please have an open mind. But I do respect those 2 definitions from those 2 governing bodies. I just say that I'd like to add on to it.
So in your opinion, what would be the symptoms that you would say to look for in a food intolerance?
You know, in addition to the gastrointestinal symptoms that both groups say are a component, absolutely. And by the way, I should say that great examples of that would be a lactose intolerance or something known as hereditary fructose intolerance. In both cases, there's enzyme deficiencies genetically in the person, so they cannot digest the food. Or the food component. So in lactose intolerance, you have a genetic abnormality where you do not produce the enzyme that digests milk sugar, which is lactose, so you develop some gastrointestinal complaints. But in my clinical practice, I've discovered food intolerances are associated with like a myriad of reactions. Decreased performance due to fatigue, aches and pains, increased injury risk, a reduced absorption of key nutrients, reduced healing. And yes, you can associate that with a direct gastrointestinal tract symptom. I can give you an example. Let's say a doctor from one of these organizations says to a patient, you have a food intolerance to milk because every time you consume a milk or dairy product, you developed gastrointestinal symptoms, and one of your gastrointestinal symptoms is acute diarrhea. Within minutes of consuming the offending food, you have a loose stool. Well, it's common knowledge that if you have regular diarrhea, you will develop a poor absorption of some key nutrients. So then you should be adding on all these secondary symptoms. You might reduce your absorption of B12, reduce your absorption of iron. Just in those 2 examples, you then would definitely expect, oh wow, this patient now has fatigue. This patient's tired. This patient's exhausted. We can't just separate those symptoms apart from each other. So I'm hoping I'm making that clear to the audience that You can have symptoms that occur that are gastrointestinal-wise, but then they can lead to a whole host of full body symptoms.
Now, what is the difference between an intolerance and an allergy and an autoimmune disease such as celiac? Like, I know you have a personal story about this yesterday, so I got a message checking in with you, and you said, I'm sorry, someone just served me dairy. I have to go home and take an antihistamine. So can you just kind of dive into that?
Yeah, and I'm going to start there if you don't mind, and then I'll rewind into answering that question. Yeah, so I've been away from dairy knowingly for 29 years. And I'm militant about announcing my allergies wherever I go because they're real and they dramatically affect my life. And for the listeners that may not have heard a previous broadcast, I have an autoimmune disease, a genetic autoimmune disease called celiac disease. And that is a lifelong inability to digest the proteins that are found in the common gluten-containing grains. That results in an autoimmune disease reaction that can destroy the lining of my gastrointestinal tract. So that's completely different from a food allergy. Food allergies will not permanently destroy a lining of a gastrointestinal tract. And if I were not treat my disease by avoiding gluten, I could actually end up having some horrible conditions, and one of which is the worst I can think of, which is cancer. So that is an extreme difference between celiac disease and food allergies. And on the other hand, I have an actual clinical diagnosed food allergy to dairy. So to the story. Yesterday I was dining at a restaurant where I go with my wife for the last 15 years. I know everyone there from the chef to all the different managers they have had. I ordered a dish that is basically kind of like shredded chicken with a bunch of healthy vegetables and more on the Mexican side of spicy. And the traditional way they prepare it in the restaurant is with a layer of some type of Mexican cheese on the bottom of this dish. And I've always, as I can't make this more clear, for 15 years, had this dish and other dishes where that is void my allergy. I make it very well known to anyone who's serving me because it greatly disrupts my life. Thankfully, it will not kill me. It can make me feel that way, that I'm seriously in peril. So I was served and I took a bite and I said, this does just not taste right. And I'm embarrassed to admit this, but I don't even remember what cheese tastes like because it's been 29 years. As you can probably imagine. So I just said, this tastes off and a little funky and it's weird. And I started moving my fork around and I was sitting with my wife and we kind of panicked. And I saw the manager walk by. It was perfect timing. I grabbed his back, threw my credit card to my wife because I already enjoyed guacamole and I didn't want to be rude and not pay. I'm that type of a nice guy and a gentleman. And I said, look, sorry, so I have to run. I have to run to pick up antihistamines and also some non-steroidal anti-inflammatories and hope that would be good enough. Because what happens to me, and it's been so many years ago, for 17 years of my life, I experienced just severe agonizing migraines from dairy products. And it took a very long time to identify that. In addition to the common gastrointestinal complaints to dairy, I would experience just blockbuster migraines that were non-responsive to the most aggressive treatment, like injectable drugs to stop the pain. Didn't do anything. And because I'm old, back when I was young, they didn't do, these types of fancy brain scans. They just x-rayed my skull, which probably explains a lot about my personality and who I am. So we'll see what ramifications transpire with that as I age in life. But yeah, through x-ray analysis of my brain, thankfully, knock on wood, I did not have a brain tumor. That's how bad the pain was. I definitely had visual disturbances. I had the classic migraine aura with regurgitation. It was, all intents and purposes, for the listeners, you could probably imagine, was one of the worst ways to live your life from age 5. Yeah, so that was like the earliest memory of migraines. And I was exposed to that yesterday and experienced a different set of symptoms that I did not have before. So with this fork full of dairy, I experienced the tightness and closing of my throat. I experienced swelling of my joints, which was really quite remarkable. One that is interesting, it's cold weather here on the East Coast, and I usually can play with my wedding ring. Men usually do that to the chagrin of their wives, and I could like slide it on and off my finger in a way. I can't even this morning budget. Last night and shortly thereafter consuming this dairy unknowingly, the pain in that knuckle was so severe, I felt like the ring was getting wrapped in the bone. It was so agonizing. And the only thing that would reduce it would be a dose of Benadryl, which I really dislike. One of the side effects of Benadryl is it disrupts acetylcholine, which interferes with how we get access to our thoughts and our memory. So if I'm slow-witted today, I apologize to all the listeners. But that is a known occurrence of this medication. So what I've been doing now is I've been dosing every 4 hours to try to head off the impending migraine, which would typically happen the day of consumption, 7 days after consumption, and then on the 14th to 16th day of unknown consumption. Thank goodness I remembered back when I was in my late teens, the pattern. So now I'm trying to head that off. Yes, a migraine will not kill me, but any migraine sufferers out there listening to this broadcast know how massively it interferes with your ability to function in life. I can't even see out of one eye when they do come on, and I still have to work and function. So that was my little story yesterday, and that's why I wanted to just, regardless of how ill I felt, wanted to do this show to talk about this from a much more personal nature than my historical medical history to the present. So to answer those questions now, Lexi, a true food allergy is an immunological response. So it's an immune system response to a normally harmless substance in the diet that is more serious in nature. For example, food allergies can be life-threatening. Thankfully, I did not, I immediately acted, and I had Benadryl in me within, oh goodness, minutes. I never needed an epinephrine pen. I don't know if I would, I can tell now I didn't die from it, knock on wood. So there are cases of anaphylactic reactions where an individual must have an epinephrine pen to save their life if they eat a food. And that food could really be anything. Mostly in the press we hear peanuts, it could be shellfish, it could be corn. There's a horrible case of a young boy in daycare where it was dairy. And that was a story that came out over the last year, getting very, very sick and needing emergency medical treatment. So that's where there's this really bad reaction. And what happens there is there's an inability to swallow, there's an inability to breathe, and that could be a life or death situation. That's the pinnacle, the zenith of a true food allergy reaction. However, not all food allergies cause that type of life or death reaction. And there's some well-known studied medical conditions that I'm really sure our listeners will know about. For example, asthma is a medical condition that can be caused by a food allergy, or it's considered to be a comorbidity, meaning something that happens along with a disease that can make that condition worse when you eat that food. So a patient could have asthma for whatever reasons, genetic, just the way their lungs are, maybe they produce excess mucus, maybe it's their environment, maybe they're allergic to grasses and pollens, which we do not eat, right? But they also potentially could have a reaction to a food, maybe eggs. And whenever they have eggs, it exacerbates their asthma. In other cases, I've seen in clinical practice where foods were actually the full-blown cause of that condition, asthma. And just identifying the true allergen and removing those either drastically reduces the need for an inhaler medication or not even needing it at all, which is really quite traumatic. There's a list of food allergy symptoms that are very well known in medical literature. I could run through some of those. We can clarify if you think I'm being too complicated, but common ones could be vomiting, it could be colic in a baby, diarrhea, eczema. That's interesting. A lot of people walk around in life with this eczema skin condition and they just use topical medications, where I'm not saying don't do that, but I'm saying why not know the full story, right? It's only reading the first few chapters of a book. You can get really excited. Shouldn't you find out how the plot thickens and potentially the conclusion? See if there's food reactions. Atopic dermatitis, which is another type of rash or skin reaction. Sinus problems, they're clinically known as rhinitis. Sinus problems that could actually affect the eyes. It's known as rhinoconjunctivitis. You could have all this crusting in your eyes in the morning. That's really bad. And sometimes you need eye drops. That's strongly associated with food allergies. Hives. There's actually people who live their life with the medical term is urticaria, which, by the way, is fascinating. It comes from the nettles plant, Urticaria dioica. But anyway, so urticaria is this hive-based reaction that's really strongly linked to foods. And then I could go on that there's like conditions that are horrendous, known as eosinophilic esophagitis, where you don't fully process and have food leave the stomach as quickly as it should. And it results in some horrible symptoms. And all of the medical literature is showing, wow, we really need to look at foods in this type of reaction. So to just try to clarify and sum up food allergies and how they're different from food intolerances is that there's a massive immunoglobulin reaction, antibody reaction, I hope that makes sense, that can cause some serious medical conditions and be associated with medical conditions that can be repeated multiple times when you can consume them. And usually people can find a direct association between eating that food and not. What's interesting is food intolerances also can have immunological reaction, but will definitely never be the cause of anaphylaxis. Food intolerances will hopefully, thankfully, up into the most latest medical literature, not be a life or death situation.
And the symptoms do vary from person to person based on the severity. So I know I have a friend that's lactose intolerant as well. And same thing, when she consumes dairy, she has to go to the bathroom within like 45 minutes. Whereas if I consume dairy, I get bloated, my stomach gets upset, my skin breaks out, and then I'm more sore after my workouts for more days. So it really does vary from person to person, and you have to listen to your body and really become aware of those symptoms.
Absolutely true. And in every disease, or I was going to say in my case, celiac disease, there's also a dramatic difference in symptoms and how people present with that. So every single reaction and every way a specific diagnosed disease manifests can be different in each individual. And it's so important to listen to our bodies. And I tried to talk about that in the last lecture, and perhaps we'll cover that today as well.
Now, in your years of practice, what was the most common food intolerance that you saw?
You know what's fascinating, Lexi? I never even thought about it until towards the end of my clinical practice, when I stopped around 2013 to work more in clinical research and to start the company Vitalaire, the parent company of Modus Nutrition, Power On, Power Off. And I started looking back at the clinical records, and there was an overwhelming chronic dairy reaction that I would see across the board. And I used so many different types of testing modalities that's what made me really think something's going on here. So that above and beyond was the number one food reaction that I saw. And that was followed by egg. And then I would definitely see wheat pop up here and there, but I want to make something really clear. One person's food could truly be another person's reaction food. So one thing we use to nourish ourselves, someone else could have a major reaction to.
Now, what were some of the rarest food intolerances that you found? Or even, I know one time you mentioned someone was allergic to a type of tree.
Yeah, that was, thank you for that. It was one of the most bizarre reactions I saw in clinical practice. I tried to look at everything when I was trying to solve a case, right? If someone said to me in the most layman terms, define what you did all those years with all these professional athletes, I was the connect the dots guy. You know, someone would come in and they'd have this long history of why they couldn't excel, but they were drafted in the first place, and why their careers went south. And I would try to be a sleuth and put all the pieces of the puzzle together. And there was this family when I was working with a professional baseball team on the East Coast that the father, who was like a gold glove, like phenomenal baseball player, his symptoms were similar in the son. And one of the components of diagnosing a food allergy reaction is actually going through family history. So I asked if I could really get a better look at the son, and I identified a serious oak tree reaction through confirmation through a clinical medical doctor, allergist, board certified in clinical allergy medicine, and identified this on a skin scratch test and on an immunoglobulin IgE blood test. So forget the complex nomenclature there, on a very specific special type of blood test to look for an immediate allergy response. This child was really off the charts. And sure enough, every time he went outside in their new home, he experienced such severe reactions that his eyes would swell shut. He couldn't even go outside and play. And I was the one who identified it was oak trees. And I remember telling the father, this famous baseball player, and he couldn't come in to see me, so it was on the phone. And I heard him scream and go, "Oh my goodness." And I said, "What's wrong?" And he said, "When we built this new estate, I actually had oak trees put in this area. They're typically not there." I'm not going to name the state. I don't want anybody identify the privacy reasons. But I was so blown away. But that was a perfect case of connect the dots. Another one that I identified that was so rare, and it was one of my favorite cases, and I didn't talk about the specifics of the case, but I talked about the condition on where I was a guest on a podcast, and I had a lot of direct messages over this, was I identified the first case I knew of on the East Coast of alpha-gal syndrome, which is an extremely fascinating example of a serious delayed food allergy, clinical delayed food allergy reaction that is caused by being bit by a Lone Star tick
Hmm.
that has Lyme. And what it does is it transmits in the infected patient a delayed allergy to red meat, and including pork as well. And this is a significant delay, and it makes it virtually impossible for the practitioner to identify the allergic reaction because there's such a drastic reaction time, 4 to 7 days between I went out and I had a steak and 4 to 7 days later, the patient is extremely sick and developing hives, potentially having out of the blue trouble breathing, gastrointestinal complaints, just a whole long list, a plethora of symptoms. And doctors are vexed and they're scratching their head trying to figure out what is wrong. I actually had a patient that was accused of being a little trouble in the skull, a little mentally disturbed, or not being believed in clinical practice. So I had to use this type of sleuthing techniques, multiple forms of measurement, working with peers and colleagues to identify that case. And I did. I was able to prove on this same exact specialized type blood test and skin test, and through the classic journaling and repeat consumption, which is known as an oral challenge, the symptoms. And lo and behold, we were able to identify and prove that's exactly what the case was.
Now, in the tests that you did over the years with your athletes, how common was it for people to have more than one food intolerance?
You know, that's a really good question. Thinking back over my years, I would say it was an extremely common occurrence for the simple reason that I believed that I followed the facts. The facts of the clinical literature is one test is not 100% definitive. There's really no such thing. Even in my disease, you can get unbelievably pinpoint accurate in celiac disease. You could genetically test, which just shows an increased risk for that individual. You can then do a blood test that is not 100% accurate. If you do the correct blood test, you must do, of course. And then you require a biopsy to finally prove this absolutely is my disease. And nothing's completely foolproof and 100% in life, as they say. So for me trying to identify what type of reaction an individual would have, I would use multiple analyses, which would include food journaling, which is the #1 method, having individuals write down everything they're consuming, their own self-reported symptoms, which yes, they can be jumbled and mixed up. You probably are listening and going, what about that alpha-gal syndrome? How could possibly, you still need that data. It's very important. People can tell you how they feel. Listen to Lexi, listen to my story after my experience of what my wife calls getting punked, right? Or I would call it getting slipped a Mickey for any older listeners out there. So I would run multiple analyses, different antibody responses. All modern medical literature is saying it's more than just an IgE response. And that's the type of an immediate antibody that's been strongly linked to identifying a food reaction, a food allergy reaction individual. So if I could be technical for a moment, Lexi, and help me clean this up, if you don't mind, in this multiple analyses, I would do the following. I would do an IgE, I would do non-IgE mediated reactions, which would be known as IgG4 subclasses. I would run something known as an ALCAT, which was backed up on Yale and could be done in triplicate double-blinded, have an accuracy up to 96%. So this was the type of data that I really liked, as well as a skin scratch test with a nurse that was, and a physician that were clinically trained in allergy medicine. So all of that together, while an individual was on a full inclusive diet, would help me identify what potentially could be a problem food. I hope I'm making sense there.
Mm-hmm.
Help me clear that up, please.
So that one does make sense. Now, if people were going to their physician because they want a clinically diagnosed information and all the tests run, what would you recommend that they ask for?
There's a lot of people going to be really mad at me on this. I'm going to be completely honest. Because we want to, so I guess I should rewind just for a second and say, that's why I would find more than one food reaction. Sorry, Lexi, that I didn't fully answer that previous question. I went on a diatribe to explain why and then never explained why. So when you're looking at different types of immune system responses, you can kind of find the levee break. And it also helped me identify why some people with my disease maybe were refractory and didn't fully get healed or reduce their symptoms, right? One of my specialties was other celiac disease patients that would get diagnosed would come to see me and say, why am I not fully well? I gave up gluten 100%. My doctor's testing my blood, proving I'm not eating gluten, but I'm still sick. And because I would run all these different types of antibodies and skin scratch testing, we would then find reactions to eggs, potentially reaction to a specific bean or to a pea or to fish. And then they would get a complete story. And why did they have those multiple reactions? Those were known as intolerances that can go away over time. The true governing problem was the disease, celiac disease, and sometimes there's a true allergy with it, like in my case, dairy. But could you imagine if I had celiac disease only diagnosed and not my dairy allergy? I would still have a multiple long list of symptoms, like I experienced yesterday, and complain that celiac disease diet didn't help me, and potentially harm myself by not caring. 50% of people with my disease still eat gluten. And that's really sad because it leads to cancer, which you don't want to do, and other diseases which are frightening. So that's the main reason why. So I apologize that I did not fully answer that. So now
I just want to jump in here before we go back to that question is,
yes.
Now that I have eliminated dairy completely, I'm currently experimenting with eliminating gluten. So over the past couple weeks, even over the Christmas holidays and New Year's and all the family dinners, I avoided gluten. So no more pasta, no more bread. I'm experimenting with gluten-free types of carbs, but it's also difficult to find little treats here and there because there's no dairy and no gluten now. But in future episodes, I will report back with how my gluten elimination diet is going and if it is worth something. But personally, I feel a lot better just eliminating gluten in addition to dairy. So I might be one of those cases where it is too. And I'm not going to a doctor right now. I'm not getting diagnosed for anything. I'm just trying it myself to see how I feel. So if you don't have the budget to go see a doctor for one of these tests, you can eliminate, track your food, track how you're feeling, and go from there.
That's so important. And I guess I should lead there in my answer, even though I peppered in, people will be frustrated with me because I'm really that type of academic that wants to get everything done as accurate as possible. I mean, please, for the listening audience, understand that the patients I worked with were the top of the top elite athletes in their field, and their livelihood depended on their excellence on the field. So my margin for error was extremely small. And I needed to eliminate that to the lowest percentile possible. So let me first answer Lexi's perspective, and I applaud you for that, Lexi. One of the most important things I would say to everyone, even these elite athletes, is journal, journal, journal. And a great place to start is a food frequency questionnaire. There's many academic groups that have food frequency questionnaires from accredited governing bodies where you could simply just check off how frequently you consume all the different foods in your diet through different food groups. And you know what? Start with what you most frequently consume. If you're feeling something, gastrointestinal disturbance is something that's bothering you, does it hurt to map it all out and then say, hey, you know what? I seem to eat eggs every single day. Or I had one professional athlete say to my face, and I went, boing. He said, I eat 28 hard-boiled eggs a week.
Oh.
And he never told me this, by the way, in his diet history evaluation. That was forgotten. When I ran testing on him and I said, you have a big reaction to eggs here. He said, I literally have them in bowls in the rooms throughout my house because they're a great healthy food, great source of protein. And wow, needless to say, we stopped that and had a dramatic benefit in this athlete's life. So he could have journaled, identified that, and stopped it. So for those that want to do or can do or have the ability to do a little bit more, I think there's at least 4 things you should look into and maybe look at maybe trying to do some of those, but please let me just explain them briefly. I think it's really important to have a quality immunoglobulin IgE, known as an IgE RAS blood test done to foods and inhalants. And I'll leave it up to you to talk to your doctor about how to get that because, I've used different labs and like different labs and I'm not paid for by any laboratories. But I did favor one that I used in clinical practice. I also would do a delayed food antibody response known as an IgG4. And I liked that one because there's so much criticisms in the literature towards IgGs, and IgG alone, it's a subclass of an antibody. I hope that makes sense. It's a component, a type of an antibody. And just the IgG, those letters, can have a high rate for false positives. Just what you eat.
Now for that,
Yeah.
I know a couple of months ago I had asked your opinion on the hair. Like pluck a strand of hair out of your head, mail it into someone, and see if they can test your intolerance that way. So those food intolerance tests out there that are being marketed where it's swab your mouth or pull out a piece of hair are not effective, is what you're saying.
Yeah, no, they're not true. They don't have any medical literature to back them up. And there are published data on what I'm saying. Like an IgE has been the gold standard along with skin testing and questioning and oral tolerance and repeating that, right? That's been the clinical mechanisms for years. But now with modern medical literature and the aforementioned at the top of the show, two governing agencies, groups in the medical field for allergy and immunology, they're saying, hey, we got to expand our definition. Food and allergies are more than just an IgE. There are also non-IgE mediated reactions. So, you know, I've read some published studies over the years. I liked one by Dr. Jeannie Driscoll, published in the Journal of the American College of Nutrition, one of my professional nutrition associations, and showed an IgG4 subclass could help patients with irritable bowel syndrome. So, and yes, there are more studies built upon that. So to conclude that statement, I found an IgG4 to be really accurate. Just pick up a few foods here and there, and they're classified at different ranking levels, and then I would be able to eliminate that. Outside of the antibody response, I liked a specific type of reaction known as an ALCAT test, and that's been duplicated multiple times in clinical literature. Most recently, Yale University has published some studies on, Lexi, you'd be interested in this, came out actually only several weeks ago, a really solid definitive test result on humans, double-blind, and identifying gluten intolerance for those who don't have celiac disease. So that fascinated me. And the accuracy of their test repeated 3 times was up to 96%, but the low margin was 92. So I knew going in and I could educate my athlete, hey, this test can have an accuracy of 92 to 96%. I think we should add this into our arsenal because it's not looking for IgE, it's not looking for IgG4, and it's looking in a completely different area. And there's a great body of data, multiple over and over and over again on human beings, showing how it improves their symptoms. And by the way, it's been done on a lot of professional athletes. So having all that together with the last one, potentially a skin scratch analysis, which is another classic test that traditional allergists would do. Medical doctors, you go to see them, I think something's bothering me in the environment, potentially a food, and they would use some type of skin scratch method, injecting just gently under the dermis the substance you're allergic to see if you have a reaction known as a wheal and measure the size of that reaction, the diameter, and then diagnose you with that type of allergic reaction based on its severity. And that has to be done in a doctor's office because you're actually exposing the person to an allergen, which you're not doing on a blood test that I mentioned. So that has to be done under the presence of a physician, because there have been people that had this type of testing done and actually were anaphylactic to what they were exposed to, and I actually witnessed that. You know, I worked in an internal medicine clinic where we had an allergy group that we worked together in tandem to try to identify, do everything could to identify food allergies. So I hope that that gives a nice, robust picture of how aggressively I would pursue food-mediated reactions in practice.
So if you, the listeners at home, want to approach your physician about this, the tests, I'm just going to recap, are IgE, IgG4, so not IgG, an ALCAT, and a scratch test. So those are your 4. You can get any sort of combo depending on what you're looking for, or just try eliminating a food from your diet if you don't have the budget or the time or the resources.
Absolutely. Perfect summary.
Now, I want to go back to that 28 eggs a day story. Now, is it possible for you to develop a food intolerance from eating too much of a certain food?
And this is what's always fascinated me about this. Under certain circumstances, yes. And I hope that really makes everybody listening right now go, oh my goodness. Yes, there are things that can happen to our bodies in our lives that can actually increase our risk for developing a food-mediated reaction, an allergy or a food intolerance. And that behavior or experience would be magnified on what was coming in continually or based on the specific protein makeup of the food, which I find such a fascinating sub-science of this topic. So let me give you a couple of examples, if you don't mind, Lexi. People may not know this, but just being a high-intensity training athlete or professional athlete can increase the risk for food intolerance or even an allergy. I'm going to stop there, and I want to jump to another experience. Just traveling to an exotic locale and unfortunately ingesting a protozoan, getting a foodborne illness, getting giardia can increase the risk for developing an allergen. Having Digestive enzyme insufficiency due to a prescription medication you were on for a period of time can result in an increased risk for an allergy. Finishing a course of multiple rounds of antibiotics to fix an unfortunate infection you got because you just have, maybe you're on a plane flying for 12 hours back from some country and multiple people were sick and you need all these drugs and you talk to your relative. Wow, that year I was sick for like 3 months. You could come out of that with a higher risk for a food allergy reaction. Everything I'm saying with those experiences I just gave are extremely well known in the clinical medical literature. And if you want, we can briefly break those down one by one, but it really has fascinated me for years. And it's why I have done this, and it gave me the most joy in my clinical practice was identifying these things. Like I met a woman that actually heard me on a radio program prior to traveling to Belize, drank some type of like ceremonial thing they did. I don't know the exact specifics about it. All I knew was I identified the protozoan that she got infected with when she was extremely sick, and she developed an immunological reaction to dairy products after that infection and subsequent treatment, which required very powerful medications, extremely powerful medications to treat different types of microorganisms that are not exciting to know about. And that was all done on the care of one of my great heroes in life. He's a parasitic specialist here in New York City. And as soon as I saw there was a problem, immediately referred her to him. He made all the diagnoses, and then I had to figure out what foods were actually causing the new problem she never had before. So it's extremely interesting. Life can cause these problems. Yeah.
Now, one of the things that you mentioned with the NHL group was that athletes or active individuals that work out 4+ days a week are more susceptible to developing food intolerances as well. So why is that?
Yeah, let's break that down. So hard training can negatively impact this area in our small intestine. We have these what's known as intestinal tight junction cells. They're cells that are stacked up extremely tight together. And what fascinates me is from the mouth to the anus can looked at, particularly in the old medical days, as outside the body, right? Because everything you consume through those pathways has to be processed in some way and disseminated through various portals to then be utilized by the body. Even a fat-soluble vitamin has to become part of a chylomicron, a specific type of molecule that then allows that to be utilized. So even though that will be readily absorbed, it still has to be processed in a way by the human body. So with these athletes that are training so intensely, there's increase in oxidative damage that occurs when we exercise, and that disrupts these normally very healthy cells, intestinal, we hope they're very healthy, known as that's epithelial tissue. It's tissue that can have expansions to it. So this epithelial tight junction cell in the gastrointestinal tract is also where the bulk of the human immune system resides. So that's kind of fascinating too, how the gut works. The gut has a lot of brain chemistry production and a lot of immune system production, which makes sense, right? That's how we survived as a species. If I'm eating something that has something bad in it, and this is before pasteurization and all that, my immune system should hopefully protect me from dying from that consumption. So our immune systems have this incredible important reaction in that location. So when we're exercising like crazy and we're on a professional level, we can have these substances known in the intestine that we call luminal endotoxins inside the lumen, inside the gastrointestinal tract, that can promote a systemic immune system response. This happens with prolonged exercise, resulting in a chemical change to substances that we normally have in our intestines. I can give you the chemical names. They're known as occludin and they're known as claudins. So these two chemicals change just through the crazy activity, which then can start to separate these intestinal cells. Think about like, I'm working my bicep, I'm causing micro tears. That sounds bad, but it's a good thing, right? So when we're exercising like crazy and we're having a chemical change in the gastrointestinal tract, it can gently open up, and not in every single human being, but there's this susceptibility, open up these intestinal tight junction cells, which allows partially undigested food fragments and immunological reactivity to start saying, this food could be a problem, and tagging it and creating a food antibody response. And
now, if you're eating the same food every single day while that is happening, are you more susceptible to developing an intolerance for that food?
Yes, and by nature, that can happen. But I'd like to state something that fascinates the heck out of me to this day for years, and this is a subscience that I was kind of alluding to. I had an athlete that had this exact same problem and was consuming chicken 3 times a day, but was also consuming whey protein shakes 3 times a day. And on all the aforementioned testing, it was the dairy that showed up being positive in all the testing blood work. So I had 2 positive on the 4 positive tests that showed this individual had an intolerance to dairy, and the recommendation was to stop the dairy products, and it wasn't the chicken. Have I seen chicken allergies in my lifetime? Yes, but it's extremely rare. And we can get into a whole reason as to why that potentially is the case. No one's doing clinical research on that. There's a lot of data that says, the whole how we evolved, the foods that were newer to humanity potentially could be more of an immunological alarm system. That's even true for my disease, celiac disease. Think about it. It would be unknown back in the hunter-gatherer days where we didn't have the ability to have an agrarian lifestyle, right? If nobody was making whole wheat bread and all the pasta and stuff that contained all this wheat, I wouldn't have never had the disease, right?
Yeah, so I know no one plucks wheat out of a field and chews on it. It has to be processed into flour and things like that.
Yeah, and so it's a real interesting sub-science, and if anyone is interested in going further, I would say go to academic sources of that thought process. And the best starting point is a colleague of mine named Dr. Lauren Cordain, who was a professor at Colorado State. He's a PhD and someone I've respected for many, many years. And he gives lectures academically and has written books on this, but it's his academic papers that I would ask you to read, where he actually has great clinical science and theories based on that. So consuming these types of foods that are more processed and omnipresent and potentially new to the human genome in great frequency, when you have one of these risk factors, such as being a professional athlete at the top of your game, you're at a greater risk. And by far, Lexi, so I saw this in clinical research. Most recent paper I read was by Vavucevic and colleagues. The paper was published in 2016. But so it kind of backed up what I saw in clinical practice. But by far, the segment of my practice that was the population that had the most identifiable food intolerances were the professional athletes. So that really interests me. And it wasn't every athlete, of course, but it was kind of like what some of my colleagues are reporting, like Dr. Keith Pine, who's the medical chair for the Washington Nationals. He said, I identified X percent, which was a pretty large percent, over 40% of the players on the team having a reaction. Well, think about what these governing bodies are saying, like 25% of the population may have a food intolerance, and much less than that of a true food allergy. And here's, a doctor of a medical board for a team saying it was closer to 40%. I honestly saw a little more than that with my pros, but I was a tainted pool because my pros really came to me for a reason. They came because they were hurting. They came because they needed a contract. They came to get strong so they could extend their careers.
Now, I know another thing, if they came into you with a food intolerance, is can you reverse a food intolerance? Can you outgrow a food intolerance? Because I would love to have a bowl of ice cream again without having any bloating or breaking out. I would love
there's a belief system you can, and I'll use a couple of my favorite quotes, if you don't mind. It's amazing how they just came to me, and even on this Benadryl high, I said 2 things. Absence makes the immune system grow fonder, and the solution to pollution is dilution. So when you consume something you immunologically react to, you flood interstitial cells, the fluid from interstitial cells to the area, like you have your bloating when you consume dairy, and that's why you have that bloating and tension. It's why my ring finger wouldn't move after the small exposure to dairy that I had in 29 years. Was a bad reaction. My case is a bad example, Lexi. I don't make you depressed. My case is a really bad example. But absence can make the immune system grow fonder. So if it's in the cases of a true food allergy reaction, it's a little difficult. In the case of celiac disease, it's impossible right now, and probably in my lifetime. I think it's just absolutely impossible. I don't believe there'll be a cure for that disease. In food intolerances, I've watched them just go away. And how I did that was addressing one of the aforementioned conditions, right? Was it alpha-gal? Was there something weird? Was there an infection? Was there protozoan? Was there a parasitic issue? Was there something? High-intensity exercise. What can we do to fortify the gastrointestinal tract? Isn't there clinical studies on some substances that are very well known and clinically researched, like zinc L-carnosine is a drug in Japan and it's really natural. Carnosine is a byproduct of amino acids, and zinc is a known mineral. And the combination of those two substances as a single substance known as zinc L-carnosine has been shown to help increase the tightening of those intestinal tight junction cells. Glutamine has been shown in clinical literature in some severe cases of like radiation damaged intestinal lining to help repair that. Fixing the probiotic and the microbiota. And coming from one of my alma maters, Rutgers, they have one of the biggest think tanks and databases on the various bacterial, good bacteria, probiotics and protozoic species that can reside in the gastrointestinal tract, and shifting those species towards what's good for the human being has been shown to help heal the gastrointestinal tract. And then lastly, I'm really interested in the data on bone morphogenetic protein 4, which sounds like something for the skeletal system, right? Well, it is, but like the human body is such an interesting, miraculous being, that this genetic pathway towards bone is really associated with enhancing and repairing this tight junction dysfunction, as I call it, repairing intestinal cells. So there are things that can enhance that. But what I used in clinical practice was fixing clinical deficiencies or suboptimal levels of nutrients that were associated with the deficient state, the deficient state associated with the food intolerance or allergy, eliminating the food for an entire season. I don't even want to hear about it, especially if I got a baseball player and we call that the grind. And this, by the way, that 28 egg guy was a baseball player. So, and a really good one at that. So it was no eggs for the entire season. I will nourish you. You'll never be deficient. You're not missing anything. And then in the off season, when all's said and done, we will do an oral challenge, record how you feel. And if you're kind of okay, let's do all those tests again and see how your body's reacting. So over time, you can sometimes get rid of this type of intolerance. But there's some sad people like me that, as I can see, I'm tattooed with my no ice cream for me, Lexi.
No ice cream. Now, can you out-eat an intolerance? Because there has been this huge, I don't know if it's a myth or who started it, but let's say I'm lactose intolerant. If I chug a glass of milk every single day, can I force my body to overcome that intolerance?
No, that's just going to absolutely ruin your day. That's not a good thing to do. And especially if there's a true allergy, it's extremely dangerous. There's a lot of new breaking science that I love. I think it's really fascinating in anaphylaxis, because peanut anaphylaxis is such a traumatic, difficult thing to deal with. But there are studies being done where there's extremely microscopic doses of peanut powder being given to the child with the doctor there, with the epinephrine pen. God bless these parents, as I'm a father, in the doctor's office with the whole nursing staff and everything around to try to increase their oral tolerance. There's some data there, but chugging peanut butter would not do anything. Chugging milk for lactose intolerance is not going to repair anything, particularly if you're genetically deficient. So we have a lot of new tests where we could determine things, and there are clinically proven, super accurate genetic tests that can tell you definitively if you are indeed lactose intolerant, and you really should avoid it like the plague, is how I feel. I'm not one of those people that think, well, I'll just take the substance. You're still going to feel lousy. What is it doing to you? Did you test every single essential nutrient for your life? You're taking lactate pill for who knows how much milk. What study was done for you to prove that's the dose you need for this dairy product? Is it affecting your B12? Is it affecting your iron? Is it affecting your vitamin D? How do you know that? Who's monitoring that? How often do you monitor that? These are questions you have to ask yourself.
And it also is just based on feeling. So like you said with your previous athlete, reintroducing the food at a later date if you don't have access to these resources. See how you feel, but give yourself a prolonged period of 3 or 4 months without the food to see if your body has adapted, if you've recovered before reintroducing it. So don't go a week without it and then be like, oh, I'm just going to have one cookie. This isn't going to hurt. It is.
It is. And I'm seeing more doctors aware of this. And I know we talked a little bit about what can elicit and cause a food intolerance or food allergy from exercise to getting infections. But we see the same thing in pediatrics. Kids, a very common condition is known as gastroenteritis. And did you know one of the things pediatricians now say is, oh, you know what? Your kid has gastroenteritis, just stop all dairy. I find that fascinating because they know, oh goodness, this child can now develop an allergy to dairy because there's just a greater increased pool of data on dairy being a pro-allergenic food in many cases.
So with that, we are coming close to time, and I do want to thank you, Dr. Pastore, for taking time out of your day. Guys, he had a severe allergic reaction yesterday, still woke up this morning and joined us for this podcast. He is a beast who is nonstop hustling, especially for Modus Nutrition. There's some great things coming in 2019, and we can't wait to share them with you as they develop.
Thank you.
If you do have any questions, please feel free to reach out to us. It's help, HELP, @modusnutrition.com. Every single email gets answered or passed on to Dr. Pastore to answer. And we just want to help you out as much as possible. If you guys have more questions on food intolerance, we're more than happy to do part 3 of this. We will dive in more to the gluten aspect in a future episode as well. But if you have any questions, you know where to find us. So thanks so much for listening, and we will see you next time.
Thank you, everyone. Take care.